Thanks so much. Again, thank you so much for joining us this morning to discuss Florida's near total abortion ban. I would like to turn the floor over to Paulette McElwain, CEO of Virginia League for Planned Parenthood.
Thank you, Ray. And hello, everyone. Thank you all so much for being here today. As we gather, my heart goes out to all those impacted by the extreme ban that has gone into effect in Florida this morning. It's with a deep sense of purpose that the Virginia League for Planned Parenthood reaffirms our commitment to providing essential care to tens of thousands of displaced patients in the South to the best of our ability. We know that over 80,000 patients received abortion care in Florida in 2023. And while no one provider or even one state can meet the need created by this ban, the LPP will do our level best to provide as much care for those in need as we possibly can. May 1st not only marks the enforcement of Florida's near total abortion ban, but also serves as a stark reminder of the challenges people across the country continue to face in accessing reproductive health care. Two years ago, the leak of the Dobbs decision shook our community, bringing uncertainty and upheaval to those seeking and those providing essential abortion services. Since then, we have seen the impact on lives across banned states playing out here in Virginia. In 2022, approximately 3% of VLPP's abortion patients were from out of state. As of April, over 20% of our patients were traveling from out of state each month. And just yesterday, more than 30% of folks making abortion appointments were from out of state. While we do our best to provide care for as many people as possible, for many, the burdens presented by the cost of traveling hundreds of miles away from home for several days, taking time off work, and finding childcare are simply unsurmountable. We don't need to guess what's going to happen next. We have seen it play out in other states. When individuals are refused access to abortion, their autonomy to shape their lives and futures is often denied. Studies show that when people are denied an abortion, they're more likely to experience economic hardship lasting years after the birth, and are more likely to stay in contact with a violent partner. They're also more likely to have worse health outcomes, and their children are more likely to live in poverty. In 2021, when Texas enacted a similar 6-week abortion ban, there was a large spike in births beginning 9 months later. We know that restrictions on reproductive health care access can disproportionately impact women of color, and Black women in particular, who are 3 times more likely to die from a pregnancy-related cause than white women. To be clear, this is a public health crisis. Anti-abortion advocates are willing to endanger people's well-being and safety by limiting access to abortion care. In the midst of this crisis, we are dedicated to meeting the unique needs of our patients and supporting our highly skilled providers and healthcare teams. Fortunately, here in Virginia, the progress made over the past several years allows us to be here for our neighbors in need. In 2019, the Virginia General Assembly passed the largest expansion of reproductive health care access in Virginia in decades, in the Reproductive Health Protection Act. Because of this, patients no longer face medically unnecessary waiting periods or are forced to receive biased counseling, and they are able to seek abortion care from qualified nurse practitioners and certified nurse midwives who go through rigorous postgraduate training and have extensive clinical experience, greatly expanding abortion access in Virginia. We anticipate seeing a surge of patients over the coming months while access is restricted in Florida. And we've been planning for this moment while hoping upon hope to not have to use these plans. As I said earlier, but it's worth repeating, no one provider or even one state can meet the need created by Florida's extreme ban. We will do our best to see as many folks seeking care here as we can. To meet this urgent need, we're expanding our telehealth services for primary care, gender-affirming care, and medication abortion in Virginia to help ensure Virginians continue to have access to care they depend on from VLPP as we expand schedules to accommodate folks traveling from out of state for care. Over the last year, we've strengthened our workforce by recruiting and retaining excellent providers, nurses, and health center staff across our 4 health centers located in Richmond, Hampton, and Virginia Beach, so that we can increase capacity to meet the need of patients traveling for care. Lastly, we're continuing to invest in patient navigators to offer support to those traveling from out of state, ensuring they have as smooth and supportive a journey as possible to access the care they need. It's going to take all of us together to meet this moment. And VLPP is committed to championing accessible and equitable reproductive health care no matter what. Now I'd like to introduce Dr. Shanti Ramesh, VLPP's Chief Medical Officer.
Thank you, Paulette. Good morning, everyone. I wanted to address the profound impact of Florida's 6-week abortion ban on patients and their access to crucial abortion care. Since the Dobbs decision, I care for patients every day who drive 6 or 9 or 12 hours to obtain an abortion. I take care of patients who have never flown before coming to Virginia for their abortion, and patients who are often panicked at a canceled flight or a flat tire that means that we won't be able to see them. Prior to today, Virginia was an important piece of this puzzle, but after today, I am increasingly concerned about not just Floridians, but the entire region and the critical role Virginia plays. While in Virginia, we have made progress through the Reproductive Health Protection Act, which allows us to see patients in one day without a waiting period, navigating care thousands of miles away before you may even know you are pregnant feels nearly impossible for many of the patients I care for. Patients seeking an abortion are often lower income, without paid time off, and with transportation and childcare concerns. We have seen in states with an abortion ban that half of women will not access this important care. I worry for those patients, their families, and their futures. As an organization dedicated to championing reproductive rights in healthcare, we cannot ignore the devastating consequences of such restrictive measures. We stand in solidarity with those affected, affirming our unwavering commitment to serving patients regardless of the challenges they face. No matter what obstacles are thrown our way, our mission remains clear: to provide compassionate, non-judgmental care to all who seek it. We will continue to fight tirelessly to ensure that every individual has the autonomy to make their own healthcare decision and access the services they need when they need them. Thank you for your continued support as we navigate these challenging times together.
Thank you so much, Dr. Ramesh, and thank you so much, Paulette. Now I'd like to introduce Jamie Lockhart, Executive Director of Planned Parenthood Advocates of Virginia.
Thank you so much, Ray. Good morning, everyone. As Ray said, my name is Jamie Lockhart, and I serve as the Executive Director of Planned Parenthood Advocates of Virginia. I'm here on this dark day to shed light on the far-reaching implications of Florida's near-total abortion ban and emphasize why protecting our right to reproductive freedom is more critical than ever. First, I want to speak about how we got here. Nearly 2 years ago, the United States Supreme Court overturned Roe v. Wade and gave politicians the green light to ban abortion. We've watched as state after state has enacted dangerous, cruel, and restrictive abortion bans, forcing people to travel hundreds of miles to access care, seek to end a pregnancy outside of the healthcare system, or remain pregnant against their will. On April 1st, 2024, the Florida Supreme Court broke 40 years of precedent by removing abortion protections previously provided by the Florida Constitution, triggering a 6-week abortion ban to take effect in 30 days. Today, May 1st. Today, millions of Floridians effectively lost the right to control their own bodies and their own private medical decisions without interference from politicians. Polling shows that a majority of Floridians, just like a majority of Americans and Virginians, are against these cruel and dangerous laws. People want the freedom to make their own private medical decisions. A public health crisis is being created in the Southeast. Florida providers have been offering abortion care to more patients than any other state except California. As Paulette and Dr. Ramesh shared, Virginia providers will do what they can to see as many patients as possible. But we know the remaining states with access cannot absorb Florida's patient base that included people from throughout the South. Virginia is now the last state in the South without an extreme abortion ban. Let's talk about what it looks like between here and Florida. Georgia and South Carolina also have 6-week bans in effect, which, reminder, is before many even know they are pregnant. And in South Carolina, they had SB 20 take effect last July 1st. The monster abortion ban passed the legislature in less than 48 hours and bans all abortions after 12 weeks of pregnancy, except in very narrow circumstances. And it requires patients to make an extra in-person visit to a health center to sign a stack of paperwork and hear a state-mandated script. Then they must wait 72 hours, and I'm going to say that again, they must wait 72 hours, one of the longest waiting periods in the country, before they can receive an abortion. To be clear, there is no medical reason the first visit needs to happen at all, much less requiring it take place in person. As a result of this harmful law, at any given time, roughly half of the North Carolina abortion appointment slots are filled by people making their first medically unnecessary mandatory visit, not patients actually receiving abortion care. As we have mentioned, abortion bans are disproportionately harmful to marginalized communities who are already more likely to face financial, geographic, and systemic barriers to accessing healthcare. The harms are especially pronounced for Black and Brown folks who experience medical racism and economic disparities that increases their risk and incidence of maternal mortality. Undocumented people, young people, those with low incomes, people with disabilities, and those living in rural areas face additional barriers in accessing care. It's clear that these restrictions and bans do not reflect the will of the people. Time and again, we've seen voters stand up against these draconian laws through ballot initiatives. The public has shown a robust desire to preserve and protect reproductive rights, pushing back against overreaches that threaten our bodily autonomy. When abortion is on the ballot, reproductive freedom wins. We've seen this ring true in states across the political spectrum, including Kansas, Kentucky, Ohio, and Michigan. And we're excited to be working with our legislative champions so Virginians get to have a say on their reproductive freedom and ensure long-term protections. It's a long process here, requiring the Virginia General Assembly to pass language twice with an intervening election, but one that is worth it to ensure that politicians cannot take the Commonwealth backwards by restricting or banning essential reproductive health care in Virginia. Our rights should not be a political football dependent on who is in office, and we have our sights set on November 3rd, 2026. I'm grateful to live in a Commonwealth that allows people to make their own healthcare decisions. Now it's up to us to keep it that way for generations to come, for Virginians and for those across the South who will be forced to travel here to access care. Thank you. I'll turn it back now to Ray.
Thanks so much, Jamie. Now I'd like to open the floor for questions. Again, please use the Q&A feature in order to ask questions. The first question is from Margaret Barthel. Do you have any data about where out-of-state patients in Virginia are traveling from? And are there any numbers on where in Virginia the numbers of out-of-state patients are coming from?
Thanks, Ray. So I have